The rapid invasion of the coronavirus is exposing the weaknesses and inequalities in our social and economic structures. Would its dramatic impact be a fleeting moment, or would it force a fundamental rethink of our systems? Hello and welcome to Bigger Than Five with me, Rida Fakhri. The world mourns as the coronavirus rips through communities around the globe. But this pandemic is proving to be not just a tragic health crisis, but a devastating economic calamity as well. The International Monetary Fund says the world is facing the worst global economic downturn since the Great Depression, with the poorest countries suffering the most. Yet, as governments scramble to restructure their social welfare policies, even the wealthiest countries are struggling to provide relief. Here in the United States, trillions of dollars have been allocated to cushion the economic impact of this unprecedented crisis as the death toll and unemployment rate continue to rise. In a country where medical insurance is still largely tied to one's employer, this health and economic disaster is exposing cracks in the American socioeconomic model. Here's how the crisis is being felt through the prism of three Americans.
There's people that are sick, and then there's people that are just mentally drained right now.
It is definitely trying times for someone like myself.
I was not financially prepared for the coronavirus at all.
Earnings and profitability in this industry is so low.
Everything is just extremely overwhelming.
I'm a formerly homeless individual. I'm on disability. I only get like $800 a month. And they took out my medical premiums for January and February out of that check. So I literally only had like $400 and some to survive on before the coronavirus. So, oh my gosh, you can see, this was supposed to be my year to come out with my business, which is Butterflies Media Creations. So that's why you get to see the green screen and I have lights. I have people believing in me and stuff. So this right here is my studio. And so all of that's been canceled for me. I mean, I'm at the bottom of the barrel in my eyes. You know, I feel bad just being able to have Medicare and Medicaid to be able to say, okay, well, I can go to a doctor. And I think about all those individuals that are on the streets that don't have that.
I'm a leader of the tenant association at my building. I did lose my job last week. I worked as a travel wholesale contractor. I'm gonna apply for my unemployment benefits tomorrow. The super posted a letter sent from the management office, kind of just reminding people that rent is due. And that's making a lot of people nervous because they don't know how they're gonna be able to afford to pay rent when they're not working, they're not able to leave their homes. The Bronx, as you know, it's one of the poorest counties in America. And we've been hit extremely hard by the virus. If you have a respiratory virus, imagine living in an apartment where you have lead paint, or you're having issues with the landlord not making repairs that's causing you to have asthma. Like those systemic issues that we've been fighting to change for years, now it's just been completely put at the forefront because of the virus. So we really need help.
I have many hats that I wear, one being an Uber and Lyft driver for 5 years now. I am part-time. The demand for rides has plummeted significantly. A lot of these people definitely depend on that income, like myself, so it's trying times right now. We are marginalized. People that are doing this are doing it out of necessity. There's no sick leave or sick days or sick fund or anything like that that drivers can request compensation from. So we are very grateful that the CARE Act has extended unemployment insurance to include gig workers, but these are things that need to be permanently available to us, not just during a pandemic.
So could this be a turning point for U.S. social economic policy? Joining me now is former Republican National Committee Chairman and former Lieutenant Governor of Maryland, Michael Steele. Michael Steele, people are struggling. As we see, they're struggling to feed themselves, to feed their families, to pay their bills, pay their rent. millions of Americans who never thought they would be unemployed found themselves unemployed overnight. In times of crises, government need a strong, unified plan. Does the US federal government have one?
That's been a big undertaking, seemingly, for the government at this point, is to come together with a consistent short-term and longer-term strategy. You have the economic piece, the healthcare piece, obviously, but then you have to have all the other pieces of government, both the federal level and the state level, that pull it all together. And that's been where there's been a little bit of inconsistency. The president, has been, for example, wanting to open up the country over the Easter weekend. Well, that was not realistic. He now shoots for a May 1st date. That may not be realistic as well. Meanwhile, the country, as your lead-in suggests, finds itself still struggling to sort of understand exactly just how much longer we're going to be in this, what we need to do to get through it. And that's where the leadership of the president and the governors is really important, coming around some type of plan, which is what you've seen some governors start to do on their own.
That is what has led to a lot of tensions between states and governors and the federal government is nothing new, but those tensions seem to have reached a climax in recent days, with President Trump, in fact, saying that he has absolute authority and power to reopen this country, to reopen the US economy. What do you see happening there?
Well, he doesn't. The Constitution defines what the president can and cannot do. It also clarifies what is left to the states. And in this space, this is a decision that is made by a governor and his or her state legislators. So the president sort of beating his chest on what he can do is speaking from an authoritarian perspective, which is something we don't recognize in this country to begin with. But then secondly, that is pushed back on by the fact that Governor Cuomo, Governor Hogan of the state of Maryland, and other governors around the country have already begun to take control of this process and define it for the individual states. And they will be the ultimate arbiters of when they open schools, when they open businesses, and when their state is open for business again.
We saw the political tension surrounding a lot of these states and their governors. This crisis is also bringing to the fore the already existing ethnic and racial disparities in the United States. Is there a risk, do you think, that once the dust settles, the already heightened racial disparities and inequalities, that they will be made even plainer for everyone to see?
Well, I think they've been made fairly plain so far, and luckily the resiliency of the American spirit is such that we don't look for, in times like this, for reasons to divide each other and to be set against one another, but rather how we come together and how we unify for the greater good of the whole. And so I think that's, again, where in the past, presidential leadership has stepped into that spot and kind of helped lead the country. What we're seeing now is, absent that, the governors themselves are more and more taking on that mantle.
But are things going to change, though? Because it's interesting to note that the United States is the only developed country where most people's health insurance is still tied to their jobs, to their employers. Do you see this pandemic shifting the narrative, changing the existing structures, forcing policymakers to take a different approach? Will Republicans, in fact, accept that? Or will this also be a test for federalism?
And I think it's going to remain a test for federalism. I do not see this country on the heels of this pandemic, and certainly the devastating impact it has had on the health of American citizens will lead to a wholesale 180-degree shift in the healthcare infrastructure of the country, or how we provide healthcare. It will still largely be an employer-based system. There may be some creation of space where there's a hybrid of something close to a Medicare for all. But the cost and the consequences of that, coupled with the inalienable right of freedom to decide how you want these things to play themselves out, I just don't see the politics evolving in a way that you see that kind of shift. to your point, there will be some review and some further understanding of how we may want to look at the system going forward. But a Bernie Sanders, Elizabeth Warren style healthcare system is not going to come on the heels of this pandemic.
So that isn't going to happen just yet. But speaking about the politics, looking ahead, the presidential elections, as we all know, is going to be Trump against Biden. If the pandemic continues and if the lockdown continues come November, is there a plan B? Could these elections be canceled in any way?
No, they're constitutionally mandated. They can only be changed by an act of Congress. That will be very hard to get. The House is never going to go along with that, even if the Senate does. So the November elections will take place as prescribed under the Constitution. And that's why it's important for folks like myself and others who've been advocating for vote by mail absentee ballots for the states to get in place the mechanisms and the infrastructure they're going to need to account hundreds of thousands, millions of ballots, as opposed to having people, as we saw in Wisconsin a few weeks ago, standing in the rain with masks on 6 feet apart to go vote. That is just impractical in this November election.
Michael Steele, thank you very much for joining me.
My pleasure to be with you.
So as the US continues to consider more economic relief measures, some European countries, particularly those with robust social welfare systems, have been quick to provide financial support. Denmark and Iceland are covering as much as 75% of workers' salaries for up to 3 months, benefits which also apply to freelancers. The Netherlands and Sweden are covering up to 90% of wages. The United Kingdom is offering 80%, while Germans will receive 60% of their paycheck. So how do workers feel about this safety net? We went to Berlin to find out.
So I'm officially unemployed right now. When I started this freelance project last year, I continued paying into unemployment insurance, and I get paid like for another 9 months now. And there was another part that was like immediate help from the government for all freelancers who cannot work anymore. So I had to fill in like one form. There was like 5 questions or something. And 16 hours later, they gave me the money, which was like 5,000 euros. It's surprisingly easy, actually, because for all the bureaucracy that Germany is also really famous for, it went really fast. So health insurance wise, I'm also really happy. And in Germany we have like the public health insurance, which is like mandatory for everyone. Of every paycheck, there's like 15% of your money that goes into health insurance, and you're covered with everything. So short term, I'm not worried too much, especially because of the government support.
So what can we learn from the way European governments have responded to this systemic shock? I'm joined by Mark Blyth, a professor of international economics at Brown University in the US state of Rhode Island. Professor Blyth, it isn't just Germany. Several European countries are covering a large proportion of lost wages, and they're doing it very efficiently. And here in the United States, meanwhile, although it is true that Congress has appropriated funds for that purpose, many people are simply being told, just hold on, just wait for a couple of weeks, the check is in the mail. How would you compare both responses, the European and the American, to this pandemic?
Well, the European one is definitely more efficient. It is also more effective, and it will prove to be more cost effective. There's a kind of benign reading and a malign reading of what's going on in the United States. The benign reading is this: the Federal Reserve is perfectly geared up to give money to banks. Congress, not so much, apart from maybe tax cuts. So when you appropriate money and you try and funnel it out to these households, you suddenly discover there's no plumbing to do so. The more malign interpretation is the following: the Republicans knew that they were over a barrel and had to do something for the consumption of the economy in general through direct payments to consumers. Loath to do so, they agreed to do the most inefficient method possible, checks. Meanwhile, the airlines and cruise lines and other firms that are being bailed out, do you think they're waiting for checks? I bet they got a much more efficient payment mechanism going on.
Can the US, though, shift to the European welfare state system? Is it a matter of fiscal revenues, of taxation, or is it simply a matter of political priorities? Because when you think of it, look at the budget that the US government gives to the military industrial complex, defense spending. It dwarfs the spending of many other rich countries.
Oh, I think that's absolutely correct. I would go further, however. It's also the way that the whole economy of the US is kind of fine-tuned and optimized. Everything runs so long as everyone's working, so long as credit is flowing, so long as liquidity is in the banks, it's great. But it runs without shock absorbers. There's no airbags. There is no welfare state. If you think about the healthcare system, it's a private healthcare system. A large part of that is for profit. When the people who are paying those premiums go under lockdown or lose their jobs, the entire system is enfeebled. So the United States has deep structural problems in the way of responding to a crisis, as well as political ones.
And what's interesting is something you wrote recently in Foreign Affairs. You said the United States, with its 330 million people, 270 million handguns, 80 million hourly workers with no statutory sick pay, and 28 million medically uninsured, faces challenges quite unlike those in other countries. Tell us how.
If you have a privately run healthcare system that relies upon voluntary contributions, when you get hit with the pandemic, that's a very fragile set of institutions. When you have a banking system which is geared to basically keep liquidity flowing at all costs, and you adjust the economy usually through unemployment and budgetary tightening, you can't do that in the middle of a pandemic when 70% of consumption disappears. European societies and other societies have different shock absorbers. They have big welfare states that are able to bring these to bear to cushion these shocks. The United States simply isn't built that way.
But is it just a structural problem, or is it political will as well? Because presumably many other countries, many other economies cannot sustain as well a lockdown that goes on for very much longer.
And that brings us to your earlier comment, the role of the dollar. The United States prints the global reserve asset. It has the one thing that everyone else has to earn in order to do imports. And yet, what do we do with it? We're still spending that money on sending people into space for Space Force. Meanwhile, the amount of appropriations for actual healthcare in the stimulus package is a fraction of that. So yes, there are deep political problems too.
And there seems to be this consensus today that there is a world before the coronavirus and after the coronavirus. Do you think this is a fleeting moment, or will we all be forced to reconsider the way we do business, the way we travel, the way we consume and produce once the dust has settled and this virus is put out of business?
Well, it depends on if and when the virus is put out of business. The problem is at the moment we don't have enough data and we have too many opinions. What do we know so far? We know that we've taken one hell of a shock to the economy. If we're able to contain that shock and that shock goes away and we're able to do without multiple waves of the virus, the before and after might be quite benign. On the other hand, if we have to face multiple waves, particularly with enfeebled healthcare sectors like the US, then we may have a bigger moment of reflection, to put it mildly.
Does it depend on how long this pandemic goes on for, how long the lockdown goes on for? Is it going to be business as usual, do you think, after this? Is it going to be business as usual until the next pandemic hits?
These are all big questions for which I'm not well equipped to answer, and neither is anyone else at this juncture. Suffice to say that if you have an economy that runs on cash reserves of 15 days and you put people into lockdown for 15 weeks, there's a bit of a problem restarting it.
We'll have to leave it there. Mark Blyth of Brown University, thank you very much for joining us on this program.
Thank you.
And while the United States and wealthy European nations are providing financial support to their citizens, developing countries face a different reality. With $11 trillion of external debt due by the end of this year, most emerging and developing markets simply cannot extend financial support to their affected workers. Over 60 countries are spending more on debt payments than on public health. So to help these countries weather the crisis, dozens of organizations are calling on wealthy governments and global financial institutions to delay, ease, and perhaps even cancel these debts. One person calling for that relief is Sharan Burrow, Secretary General of the International Trade Union Confederation. She joins me now from Brussels. Sharan Burrow, your organization represents the interests of 200 million workers in more than 160 countries. How concerned are you, though, about the impact this pandemic will have on the workforce in the developing world, especially in those countries that are hugely indebted and struggling to stay afloat?
This is the greatest economic, social, and humanitarian disaster we've seen in our lifetime. The developed economies are struggling. But when you think of the developing economies, $96 billion has already escaped from there in capital flight. For these countries that were already indebted, the poorest of our countries, then they can't afford the support that the richer countries have given their workforce and their employers. Wage support, income support for the people on non-standard forms of work, rent, mortgage support, many other forms of allocation of finances that these countries can't support. So debt relief is fundamental.
You say debt relief is fundamental, Sharan Burrow, but as you point out, this is the biggest catastrophe facing humanity in our lifetimes. The richest countries are also scrambling to get out of this situation and to keep their own economies afloat in many respects. Can you really depend on them to jump to the rescue when they themselves are struggling to contain this virus and its economic impact?
We have to. The world is interdependent. And if we don't get the health systems, the humanitarian support in terms of income and food distribution through a massive social protection fund globally, then no one will want the moral outcomes on their conscience. Right now, a country should not have to choose between debt and lives, and the richer countries must know if they don't support massive social protection along with the health systems for developing countries, this will come right back at a global economy that is not acceptable.
But do you think that the international financial system can deliver and deliver fast? The IMF's chief economist has already said that over the next 2 years, this pandemic is likely to knock off some $9 trillion from the global GDP. And they're calling this the worst recession since the Great Depression.
Absolutely. And the IMF, the World Bank, not only can countries agree to increase liquidity with liquidity swaps for developing economies, attached to the real economy, so jobs, so incomes are supported, debt relief, fundamental, and indeed realigned with the social development goals and investment, not with draconian structural reform demands, plus the support for a global social protection fund.
But can you really expect this to happen? Just take the example of Iran recently, which requested a $5 billion emergency loan. The Trump administration publicly threatened the IMF not to offer that loan, even though European countries were in favor, and the IMF complied. Do you condemn a decision like this?
This is why we need a new Bretton Woods institution, despite my respect for the managing director. The World Bank, the IMF, they have to change. If geopolitics stops us saving lives and making sure that people can have hope of employment, of income for the future, then this is not the set of shared values that we can recover and reconstruct a better future from.
But what will need to happen beyond that, though, beyond these calls? As you pointed out, millions of people have lost their jobs overnight in this country, in the United States alone. More than 15 million people filed for unemployment in the space of just 2 to 3 weeks. Is it an opportunity today to strengthen unions and the working class?
There has to be an opportunity to relook at how we provide full employment. You will lose up to 196 million jobs equivalent in the formal economy. But when you think that 60% of the world's workers are working informally, no rights, no minimum wages, we have to provide an inclusive economic future where work is redefined, where full employment is possible and people get decent wages and indeed full human and labour rights.
Will governments across the world seize this opportunity, do you think, to rethink, to fundamentally restructure their socio-economic models?
Well, with collapsing non-essential supply chains, throwing millions and millions more out of work in the developing economies, the economy won't come back to what it was before. So unless we have a recovery plan that is both about recovery, reconstruction, and resilience, that deals with the convergent crisis of the humanitarian and economic disaster, of resilient health systems into the future, but also of the climate emergency and the inequalities that were in existence but now could deal with increased poverty that we would never have expected. So an integrated global recovery plan is as important as the fundamental social protection floor the world must fund for developing countries right now.
Sharan Burrow, great to have you on. Thank you very much for joining me.
Thank you.
There is little doubt that the extraordinary economic shutdown caused by the virus is bound to force societies to reconsider their modes of development and their modes of social organization. With millions of jobs lost overnight, real structural change will be inevitable, and beyond the unimaginable death toll, this may prove to be the pandemic's lasting legacy. From me, Rida Fakhri, and the entire team here in Washington, thanks for watching. See you next time.